Professor Patrick McGorry is a world-renowned psychiatrist who has dedicated his career to the mental health issues of young people. With the establishment of Orygen and the Headspace program, Pat has proven that early intervention can change the course of a life.
I'm imagining he went through lots of hardship, but I thank him a million times over because I know I wouldn't be where I am today if it wasn't for my treatment I received at Orygen Youth Health.
From an early age, Pat's life was destined for medicine.
I had a lot of pressure in my family to do medicine, but I figured that I would find something within medicine that would be great.
And it took some time before his real ambition took off.
And I think that was true when I got into psychiatry in the mental health area. It's the last frontier in the health field where you can really do something very significant, I think.
Pat's desire for change forced him to relocate from Newcastle to Melbourne to continue his work.
It was a very big sacrifice to me, back in the 80s, moving to Melbourne because, I lived on the beach in Newcastle and that was my absolute passion, surfing.
At that time, he was one of the few people who was interested in psychosis and schizophrenia in particular.
Most mental disorders emerge for the first time in teenagers and young adults.
The irony is that the system is weakest where it's needed most. So really there's a gap in the services for young people aged about 15 to 25.
At the age of 17, I'd started having the symptoms of my major depression appear. I tried urgently to seek help from the system and pretty much got knocked back. I felt that I had no hope, and I now started looking at physically taking my life.
I think there was a lot of scepticism in the field about and lack of confidence that you could actually do anything to help patients apart from just sort of babysitting them or minimising risk.
He saw a system that lacked so bad and decided that I'm going to try and change the status quo. I'm going to try and create this fantasy of a youth mental health care system.
That was the period when it turned into EPIC, the Early Psychosis Prevention and Intervention Centre.
And that really was looking after the serious end of the spectrum in terms of early diagnosis and treatment.
There was a real aura of hope around the place that if we did detect young people with emerging and early onset mental problems, that we could prevent things like homelessness, demoralisation, social isolation.
It was a world first to really integrate the treatment in a very optimistic way. We brought optimism to the care of these young people.
Well, Orygen really is teaching, training and research together with innovative clinical care around that focus.
At my lowest, I felt alone. I felt like there was no other way to be happy than to die.
You can imagine when you're a young person in hospital with a mental health problem in a potentially scary environment, it's very important to have, well-adjusted young people around you giving you some support.
They run a peer support program to ensure that if there's concerns that a young person feels like they might only want to talk to another young person about, that they are there and available to talk to them.
I remember one particularly, I saw a young lady. She reminded me exactly of myself in hospital, and I shared a little bit about my past experience, and I could just see that she went from focusing on suicide to thinking about how she could make use of her nurses and the team around her. And I thought, even if she's just changed that thinking for an hour, that's worth it.
With the success of Orygen, Pat lobbied the government for funding in excess of $110 million to create and run a new national scheme, Headspace.
Headspace was established in 2006 and now has 30 sites operating across Australia.
You're seeing young people who are coming for the first time in a youth-friendly environment. They're kind of very relaxed about it. There's almost no stigma.
Pat comes to Headspace and works clinically here on a fortnightly basis. It's great having him here because having a psychiatrist of his calibre allows us to work with young people that may otherwise miss out on care.
Over the last 33 years, Pat has championed the cause of mental health. He's lobbied governments, resulting in millions of dollars in grants, published hundreds of articles, and now countries the world over are adopting his model.
Virtually the same program is being conducted overseas, and the support that he's getting over there is wonderful.
Really, he's looked on as being the pioneer in that area internationally.
what Pat's done is now part of the history of psychiatry.
I, like most people working in the mental health field, get tremendous satisfaction and reward from seeing people who are seriously ill recover so well and so often.
I thank him with my life, and I think my family and my friends do.